Aisha, and good evening, everyone. This is John Lasher from Partners in Health, Sierra Leone. Today is Wednesday, May 13th. There were 49 confirmed cases today, bringing the total number of cases in the country up to 387, and there's one additional death today, bringing the total number of deaths to 21. Of the 49 new cases, 45 were in and around Freetown. For today's audio update, I traveled to Hastings, just outside of Freetown, where there was an opening ceremony for the 120-bed community care center that Partners in Health helped to open in collaboration with the National Emergency Operations Center, the military, Doctors Without Borders, and the Ministry of Health and Sanitation in the country. A great relief considering today there was the highest number of cases recorded in the country in a single day. So the infrastructure work finished yesterday. The opening ceremony was today, and based on information we were getting during the ceremony, it sounded like 15 of the 49 new cases would be coming to this care center. So the 120-bed facility is for asymptomatic or mildly symptomatic coronavirus confirmed positive patients. And PIH helped to level the land. We worked with contractors and brought big machinery to level the land. We also painted all 6 of the buildings. We hired painters and bought supplies. Our procurement team and operations team were instrumental in getting that done. We also spread gravel across the campus, and we put a perimeter fence and provided security for the facility. For today's audio update, we're joined by Dr. Idris from the Sierra Leonean Armed Forces. He is a doctor who's been on site every day at the community care center working side by side with PIH's infrastructure team, and he just wanted to share a few reflections on the day that the community care center opened.
I am Major Dr. Bimba Idris. I'm the Operations Officer, EOC Case Management Pillar, and I'm also the coordinator for Community Care Center.
So can you tell us a little bit about what event happened today?
Yeah, what happened today is the opening of 120 beds facility for mild and asymptomatic cases of COVID-19. It is very important because there are people who are carriers without them knowing. So once you've been tested, it's very important for you to come into a care center. You'll be observed, 1, so that you cannot transfer the disease to other people, and then 2, just in case your symptoms get worse, we'll be able to monitor you and intervene as soon as possible.
So in terms of this facility, what was this facility before it became a community care center?
This facility was a military training facility. All these blocks you're seeing, all 6, it's blocks for female, and the military have double beds, and each block will take up to 40 cadets officers, and so all 6 you times by 4, and then you could get the answer to that.
Wow. And how far are we from Freetown now?
Yeah, we were like 20-minute drive away from Freetown.
When do you expect to have patients in this ward?
Well, we expect to have patients today, because today there are 46 new cases, and so we are planning set up the nurses into teams of shifts, and then at least want to reduce the burden on other facility. We want to accommodate at least 15. Yeah.
How did you see the infrastructure work happening here? How long did it take?
It took 16 days, and it was so much encouraging by the partners, especially PIH. Originally, they were just supposed to pave and do perimeters, but they did a lot more. They did the perimeters, they did the barbed wires for security, they did the granite leveling, they did a lot of things. We're so happy. They also intervened in technical areas and giving technical advices, and it was just brilliant. And I will have to mention Douglas. He's such a very jolly guy, and he's very easy to go with, and he's easy to work with.
It's been our pleasure to be able to work with your team and the EOC to get this open. So thank you. Congratulations.
Thank you. Thank you. Thank you, PIH. Thank you, Douglas.